Professor B.S. Sahai, Director, IIM Jammu, faculty colleagues, students, and the participants who have registered from outside IIM Jammu, all of you are welcome to our next session. This session is very important for us. We have two wonderful speakers, Dr. Kiran Mazumdar Shaw and Madam Simriti Irani, Union Minister for Women and Child Development and Textiles. Now, this session was supposed to be a single session where we had invited both of them, but unfortunately, due to certain last moment meetings from Prime Minister's office, we had to kind of break this session into two. One session which is going to be taken by Dr. Kiran Mazumdar Shah. Again, the last time meeting had given us this a situation where we cannot have a live interaction with her, although Dr. Kiran Mazumdar Shah has promised that she will be interacting with our students in March. But she was kind enough still to send us a message. There's a video message which I'm going to play, which is exclusively for IIM Jammu students on Leadership Summit. So we are going to play that video for you in this session. But before that, we have Soumya. Are you here?
Yes, sir.
Soumya is going to introduce us, although Dr. Kiran Mazumdar Shah needs no more introduction. We all know her and we all are fond of her. And as I said that she has promised that she will either come to IIM Jammu, or if the situation remains this for a little longer, the COVID situation, she will still interact with our students in March. Soumya, over to you.
Good afternoon to one and all present. Very often, women face discrimination, violence, and lack of opportunity. Despite various reasons of optimism, the overall number of women in top business roles is still significantly low. But those who dare to dream, they overcome all odds and make it happen. And this is what we look forward to discussing in this session, Breaking the Glass Ceiling. I was born to lose, but I chose to win. Moving ahead in the event, I am extremely delighted to enlighten the participants about Ms. Kiran Mazumdar Shaw. A first-generation entrepreneur, Ms. Kiran Mazumdar Shaw is Executive Chairperson and Managing Director of Biocon, Asia's leading biopharmaceuticals enterprise. Named among Time magazine's 100 most influential people in the world, Ms. Mazumdar Shaw is recognized as a thought leader who has made her country proud by building a globally recognized biopharmaceutical enterprise. Ms. Mazumdar Shaw is a recipient of the Padma Shri and the Padma Bhushan, two of India's prestigious civilian honors. As a global influencer, she is ranked among the world's 25 most influential people in biopharma by Fierce Biotech, Forbes magazine's world's 100 most powerful women, and Fortune's top 25 most powerful women in Asia Pacific. She has been recognized as the only Indian on Forbes' list of world's self-made women billionaires. Ms. Mazumdar Shaw holds key positions in various industry, educational, government, and professional bodies. Just to mention a few, she has been elected as a full-term member of the Board of Trustees of MIT Corporation, USA. She is a member of the Board of Governors of IIT Bombay, founder member of Society for Institute for Stem Cell Biology and Regenerative Medicine, Bangalore, and is the past chairperson of the Board of Governors of IIM Bangalore. She also serves as the lead independent member of the Board of Infosys Limited and non-executive director on the Board of Narayan Health. She has been appointed as member of steering committee of the National Biopharma Mission. Ms. Mazumdar Shaw was felicitated with Advancing Women in Science and Medicine Award for Excellence 2017 by the Phoenix Institute for Medical Research, USA. She has been honored with the prestigious Lifetime Achievement Award at the FICCI Healthcare Excellence Awards 2019 for her valuable contribution and exemplary work in the field of healthcare. Recently, she was also named the EY World Entrepreneur of the Year 2020. Ms. Mazumdar Shaw's journey of becoming a pioneer in her field continues to be an inspiration to all. She truly exemplifies how women who challenge the status quo rise above barriers and conquer the unimaginable. I am Jammu's privileged to hear from her through this recorded message.
Thank you, Soumya.
Hi, I'm Kiran Mazumdar Shaw, and it is indeed a great pleasure for me to speak at the second Leadership Summit at IIM Jammu. And I'm really pleased to note that this year's theme that you have chosen is about conquering the crisis, shifting paradigms, and the way forward. Because that theme actually says it all. As a woman entrepreneur and as a pioneering entrepreneur in the field of biotechnology, it is about conquering crises through a spirit of challenge. I remember when I started my company in 1978, India was in an economically very desperate stage. We were at the height of the license Raj with very little financial muscle to really move ahead. And I chose to start my company at that very challenging time. It was a crisis. In 1978, we were a struggling economy and a very frugal and poor economy. And if you remember, we were compelled into regulatory reforms in 1991. So I started my company at a time when there was a decade of challenges and crises from which we finally emerged in the 90s. So what did I have to do? I faced a large number of challenges and, you know, many people thought I had foolish courage to take on such daunting challenges. I was a 25-year-old woman with no business experience. I wasn't fortunate to go to an IIM. And I was trying to start a business in a sector that nobody understood, biotechnology. But did that deter me? Absolutely not, because I've always believed that challenges and crises throw up wonderful opportunities. And for anyone who seizes those opportunities, I think the future is not only bright, but it is a future that will fill you with confidence and determination to succeed big time. So that's what happened to me. Nobody wanted to invest in me. No bank wanted to extend a credit line to me. Even people didn't want to work for a woman employer because they felt I was not going to give them job security. But I think every one of those challenges is something I addressed with a opportunity to learn, an opportunity to become stronger, and an opportunity to basically succeed through adversity. So I think what I did was step by step, I was able to convince banks to lend to me. I was able to excite people about working for a pioneering company. And finally, I was able to start building a business through which I demonstrated my ability to be a capable business leader. So whilst everyone looks at me today as a very successful business leader, I can tell you that my early days were most challenging. And then, of course, I had to surmount even bigger challenges along the way as I built the business to earn the credibility with which I could be recognized as a successful business leader. And that's the story of entrepreneurship. Entrepreneurship is about taking an idea to the market. In my case, I started with an idea of replacing polluting chemical technologies with eco-friendly enzyme technologies. It was an idea ahead of its time because what I was saying was biotechnology has amazing eco-friendly solutions, use them. And nobody wanted to do it because they felt it was more expensive. But I used to keep telling them it might be more expensive in the short term, but it is going to be very affordable and very sustainable in the long term. And of course, today we all talk about environmental sustainability, but in the 70s and 80s, it wasn't even something people bothered about. So that is the circumstances under which I started my company. It took me 20 years to convince various industries to adopt enzyme technologies. It was a very exciting time because it was a very science-driven enterprise, and it was a research-driven enterprise. And it was something as a scientist I was very excited about. When I started Biocon in 1978, I had a sense of purposeful passion with which to build my company. One part of that purpose was to build a research-driven, scientist-led enterprise. And so I was very excited with that thought of doing so because in the 70s and 80s, it was a time when there was a huge brain drain from India. And I was very aware of it and I was very worried about it. Scientists were simply leaving India in droves to go and pursue opportunities elsewhere. And I thought to myself, why don't I create opportunities for scientists to pursue jobs in India? And I want them to pursue exciting career opportunities at a company like mine. So that was one of my very important sense of purpose that I started with. The second thing was, of course, about women. Being a woman entrepreneur, I realized how challenging it was for women to be recognized as credible members of the economic mainstream. I myself know how difficult it was for me as a woman entrepreneur to be, treated with some amount of credibility because everyone thought that I was high risk and that was most unfair. But that's where I felt that women needed to be encouraged to join the economic mainstreams, pursue career paths in companies. And I wanted my company to be a great place for women to pursue careers. So that was my second driving purpose. And the third, of course, was to make impact by leveraging biotechnology in whatever field I chose. The first field was, of course, about developing enzymes for environmental sustainability. As I mentioned, an idea way ahead of its time. But 20 years later, it did succeed. Many industries did opt for enzyme technologies and did do away with their polluting chemical technologies. Today, many of those industries, when I visit them, always say, thanks to you, we started on this path of environmental sustainability. So I'm very proud of that. 20 years into my entrepreneurial journey, I then decided to switch gears. And I started looking at all that we had achieved during my first 20 years as an enzymes company, and I realized that we had developed some very interesting technologies which could be leveraged into other areas. And I thought that one of the most exciting areas for me to really invest in was biopharmaceuticals. Why did I do that? Because India was importing all its biologic drugs, from insulins to monoclonal antibodies. And all these drugs were beyond the reach of most people in our country. India was at the epicenter of diabetes, and yet we were importing all our recombinant human insulin, which very few people could afford in the late 90s and early part of this millennium. And I thought we have to change that. In fact, most Indian diabetics would use animal insulins because they couldn't afford recombinant human insulin. And I thought to myself, as a biotech company, surely I should be able to make recombinant human insulin. Because I've made enzymes using recombinant technologies, why not insulin? After all, they're all proteins. And that's what I started with. And that succeeded very fast because one of my technologies for enzymes worked very easily to make insulin. And I continue to be using that homegrown technology, the only insulin company in the world that makes insulin using a particular yeast technology that we had developed in-house. Very proud of that. Today, we are the third largest insulin producers in the world. And I think that is a very proud feeling for all of us. And I see ourselves as becoming a very important insulin company in the years ahead, where we all are, we are committed to aspire for a world where 1 in 5 insulin products will be made by Biocon. So that is the kind of aspiration I have for insulins. Then came the antibodies. The monoclonal antibodies were a new class of drugs, and they were addressing a large number of unmet medical needs in cancer, in autoimmune diseases, etc. And once again, I thought to myself, why is it that most patients who need these drugs can't afford them? My best friend had breast cancer. She needed such a drug and she could hardly afford it. I mean, she had to almost give up her life savings because she needed that drug. And I felt that there was something wrong in the kind of price points of such drugs. And I thought if I make it locally, I'm sure I can bring down those prices. And I did. You know, everything we've done at my company, it's about access and affordability. And that became my driving sense of purpose. Saying, how do we make global impact? How do we provide affordable access to life-saving medicines? How do we basically make sure that we undo this inequity in access to important medicines? And that's the purpose with which I'm driving my business even today. I often say a blockbuster is not about $1 billion, but about serving 1 billion patients. And that's how I drive my business. My business is led with a sense of purpose, a sense of compassion and caring for our customers. And our customers happen to be patients. And therefore, as a very patient-centric company, we would like to basically make a difference to global healthcare. That is how we're leading our business. And I think by doing that, I think the world has seen during COVID how important it is to focus on healthcare and equitable healthcare. Today we talk about vaccine nationalism, where we are seeing poorer countries not having access to vaccines because the rich companies have bought them all. Fortunately, India is the world's largest vaccine producer, and we are in a privileged position not to worry about access to vaccines because we are Atmanirbhar, as the Prime Minister often refers to. And that, to me, is a very important realization and recognition of all that private sector has done in India to make India strong. I think we were all taken for granted. Nobody cared whether the Indian pharma company was exporting or developing or researching generic drugs or vaccines for the world, because it was taken for granted, saying, okay, fine, you're doing a good job, but nobody realized the scale at which we were doing it. Today, India, by volume, accounts for 50% of vaccines in the world and 40% of generic medicines in the world. That's a huge scale that we've created. And I think the government still doesn't understand that we need to bolster and boost R&D investment. Because even though we account for such a large amount of products, medical products and pharmaceutical products like vaccines and generic medicines in the world, we only account for 3% by market value. So my view is that we should move from volume to value. If we want to do that, then we have to invest in research and innovation, which we haven't done for a long time, because for a country which is very under-resourced and under-strapped in terms of finances and funding, the easiest model for us is to develop me-too drugs and me-too vaccines. But we now have the opportunity of developing next-generation medicines, next-generation vaccines, and for that we have to invest in R&D. We have to create IP. We have to license these kind of medicines to the world. Look at what COVID has taught us. All the vaccines that are being developed for COVID-19 have actually emerged from the labs of very small companies. Whether it is BioNTech or Moderna, which has developed the first mRNA vaccines, which Pfizer is marketing, and which Moderna has decided to market itself. These have come out of small biotech companies who are valued at less than $1 billion. And today these very companies are now being valued at $50 billion and above. So you can see what innovation has done for these kind of companies who would have never dreamt of such a day. But that's what science, technology, and innovation does for companies. You come out with a new drug that makes a huge difference to global healthcare, that's the reward you get. Then, even if you look at the AstraZeneca vaccine, it was developed in the labs of Oxford University. When you look at many of the other vaccines, whether it is Novavax or whether it is any other of the vaccines, these have all been out-licensed from small academic laboratories, which now leads me to believe that our academic laboratories also have to gear up and become innovators in a big way. That's the exciting story that lies ahead for India. Investing in R&D, investing in innovation, creating value through intellectual property is going to be very important in the path ahead. When going by your theme of conquering a crisis, just look at the kind of entrepreneurial opportunities that have been thrown up by COVID-19. We've been plunged into a digital virtual world. And now the world has learned to work differently, innovate differently, and create new products which were never thought of before. Who would have thought that making germicidal masks were going to be a big opportunity? Who would have thought that hand sanitizers were a big entrepreneurial opportunity? Who would have thought that developing efficient ventilators or PPEs or biodegradable PPEs was now going to become a great opportunity? And who would have thought that vaccines would become the biggest opportunity and the biggest growth drivers for the pharmaceutical world? Everyone was focused on Alzheimer's, cancer research, and other such, unmet medical needs. But today, everyone's now focused on COVID and viral diseases. So you can see how quickly companies have to pivot to address some of these emerging opportunities. But I, for one, also believe that we should not just focus on one area, because the world is burdened with a large number of diseases. And, if we take our eye off one disease, that's going to actually then come to haunt us. So as an entrepreneur, I believe that there is opportunity for every entrepreneur everywhere. And it is up to us to seize those opportunities and succeed with those opportunities. So I would like to wish this particular leadership summit all success. I am sure that you will deliberate on how to convert opportunities from adversities, how to conquer crises and come out successful. And for me, as an entrepreneur and as a woman entrepreneur, I know that I have always converted challenges into opportunities and adversities into successes. So I wish you all the best. Thank you.
Since this video is also being recorded and we are going to share as I said earlier also that without disappointing all of you, ma'am has promised that she is going to either come in person to meet all of you, or she is going to, if, as I said, that if the COVID situation remains little longer for us not to allow us to travel, then still she will interact with all of you in March, and we will be taking a lot more questions. I'm sure that all our students are excited to interact with her. It's just that at times, no, certain things go beyond our control. There was an important meeting called from Prime Minister's office. That's why all of these things had to be postponed. As I said earlier also that Srimati Simriti Irani is also joining us, although that could have been again a kind of an issue for us, that she first said that it would be better that we interact some other time, but we insisted that no ma'am, please, our students are waiting, so it's better that you interact with us, even if it's just for half an hour. So we are very thankful to her also that she agreed that at around 2:30 she will be joining us and interacting with all of you. So we will stop for a lunch break now, and we will be meeting at 2 sharp here in this hall, and we are going to have a very, very important sessions post lunch. We have the immediate session starting from Srimati Simriti Irani, Union Minister, and post that we have very, very important 2 sessions, and we have a valedictory session where Governor of Rajasthan, Honorable Governor of Rajasthan is joining us. So this is going to be all packed and wonderful sessions post lunch. So please come on time, come back on time. I see you at 2. Thank you very much, everyone. And thank you to Director Sir also for being with us since morning and attending all the sessions. Thank you very much.